Hello everyone, I am Anakha, BSc Cardiac Technology at SNS College of Allied Health Science, Coimbatore. SNS institution is the first institution to implement design thinking curriculum. Education is an urgent need of changes toward focusing on human beings and their potential and talent, and here we adopt to curriculum structures based on design thinking strategy that support to build character, skills and curiosity to learn more. In SNS, we strive to touch every leads of world we live in. Through design thinking, we focusing on deliver quality education by providing an effective learning environment and true innovator who fits the real social needs and issues. 5-pillar activity. First, Center for Learning and Teaching. Second, Skill and Career Development. Third, Center for Creativity. Fourth, Industry Institute Partnership Cell. 5. Social Responsibility Initiative. I am happy to share my article on Alzheimer's disease. Alzheimer's disease is a condition that affects the brain. The symptoms are mild at first and become more severe over time. It is named after Dr. Alois Alzheimer, who first described the condition in 1906. One of the main features of the condition is the presence of plaque and tangles in the brain. Another feature is a loss of connection between the nerve cell or neuron in the brain. These features means that information cannot pass easily between different areas of the brain or between the brain and the muscle or organ. According to National Institute of Aging, Alzheimer's disease is the sixth leading cause of death in the US. However, other recent estimates suggested that it may be the third leading cause of death, just behind the heart disease and cancer. Symptoms: memory loss, repeating the questions or conversation, losing object, forgetting about event or appointment. Problem with recognition, problem with spatial awareness, problem with speaking, reading or writing, personality or behavior changes. Then causes. Like all type of Alzheimer's develop due to the death of brain cell. It is neurodegenerative condition, which means that the brain cells death happen over time. In a person with Alzheimer's, the brain tissue has fever, and fever the nerve cells and connection, and tiny deposit known as plaques and tangles building upon the nerve tissue. Plaques develop between the dying brain cell. They are made up of protein known beta amyloid. The tangles mainly occur within the cell nerves. Research do not fully understand why these changes occur. Several factors may involve. The Alzheimer's Association have produced a visual guide to show what happened in the process of developing Alzheimer's disease. Stages of Alzheimer's disease. Mild Alzheimer's disease. Taking longer than usual to perform daily tasks. Difficult handling money or paying the bill. Wandering and getting lost. Experience personality and behavior changes such as getting upset or angry more easily, hiding things or pacing. Moderate Alzheimer's disease. Greater memory loss and confusion, difficulty to recognizing the friends or family, and inability to learn new things, difficulty performing the task with several stages such as getting interest, difficulty copy with new situation, impulsive behavior, hallucination, severe Alzheimer's disease, and inability to communicate, dependency on others for care, being unable to leave bed all most of the time. Treatment. There is no cure for Alzheimer's disease, and drug therapy for the disease is still in its infancy. Approved medication for the treatment of probable Alzheimer's disease help control the symptoms of Alzheimer's disease but do not slow down the progression or reverse the course of disease itself. Alzheimer's disease primarily damages glutamate acetylcholinease producing neuron and their associated synapse, and this damage correlate well with early cognitive symptoms of Alzheimer's disease. Acetylcholinesterase inhibitor help improve the memory function and attention in Alzheimer's disease patients by interfering with the breakdown of acetylcholine, thereby increasing the level of neurotransmitter at the synapse. There are currently 3 FDA-approved cholinesterase inhibitors: rivastigmine, alkylatamine, and donepezil. Drugs that act to decrease the amount of AD protein in the brain have received the most attention due to the prominent pathologic role ascribed to the AB in the Alzheimer's disease literature. One class of such drugs as their inhibitor which inhibit the secretory enzymes that cleave APP to reduce AB. The 5 medications are currently used to treat the cognitive problems to the Alzheimer's disease. 4 are acetylcholinesterase inhibitors and other is NMDA receptor antagonist. The benefit from their use is small. No medication has been clearly shown to delay or halt the progression of disease. Thank you for giving this opportunity for SNS institution. Again, thank you.